Hi, I'm Diane Newman, adult nurse practitioner, adjunct professor of urology and surgery at the Perelman School of Medicine in the University of Pennsylvania in Philadelphia. Today, I'm going to introduce you to the new Bladder Scan Prime Plus bladder volume instrument. The Bladder Scan Prime Plus includes an onboard tutorial, and we recommend reviewing the full tutorial before using the instrument. To start the tutorial from the home screen, press the Help icon on the console's touch screen. The entire tutorial will play. If you start the tutorial from any other screen, it will begin from that screen. Here are a few things to remember before scanning the bladder. You can perform a scan from either side of the patient. Prime Plus is preset to scan from the right side. To scan from the patient's left side, tap the icon to switch the orientation. Be sure to locate the pubic bone before placing the probe in position to scan. You will be aiming the probe toward the feet, behind the pubic bone. Apply a generous amount of ultrasound gel to the probe or directly on the patient's skin. Be careful not to touch the gel bottle tip to the probe or the patient's skin, as this risks cross-contamination. For best results, keep the gel in a thick layer. Don't spread the gel too thin, as this may result in poor contact between the ultrasound probe and the patient's skin. Using the icon on the probe display, be sure to align the probe with the long axis of the body. To begin live pre-scan aiming, press and release the scan button. Move the probe slowly, using the bladder track feature to center the bladder on the screen. To begin the scan, press and release the scan button or tap Scan on the touch screen. Hold the probe steady while the scan is in progress until the volume results are displayed. If the bladder icon is off-center, re-aim the probe, pointing it in the direction indicated to maximize the bladder image. If the scan area indicates a pubic bone interference icon will appear. Reposition the probe above the pubic bone and rescan. If more than one measurement has been taken, the highest volume will be the one most prominently displayed on the console. You can review the volumes and the 12 bladder images associated with each of your scans. If a printer is installed on the device, press Print to print the exam results or press Done to finish.